Welcome to the Deep Dive. We're the place where we take your source material, dig into it, and really pull out those key pieces of knowledge, helping you get up to speed fast. Today, we are diving deep into, well, the fascinating and sometimes tricky world of equine foals, specifically looking at a condition called flexural limb deformity. You've given us some really great comprehensive sources here. They cover pretty much everything from diagnosis all the way through to treatment, even touching on prevention. So our mission today, let's unpack all this, try to break down some of the complex medical terms, and really help you get a handle on what this condition is, why it happens, and crucially, what it takes to manage it well.
Yeah, and what's really compelling here, I think, is how this topic, even though it sounds maybe a bit niche, it actually sheds light on much broader ideas about development, about growth. It's all about that really delicate balance needed for things to form correctly, physically, and not just in foals, really, but in any young animal that's growing quickly. It's a perfect example of how even like small imbalances can end up having pretty major effects down the road.
That's a great way to think about it. So if you've ever seen a foal maybe walking weirdly on its toes or heard the term contracted tendons and wondered what that really means, well, you're definitely in the right place. Let's peel back the layers, shall we, and get into the core of what flexural limb deformity, or FLD, is all about. So, okay, let's start right at the beginning. What exactly is flexural limb deformity, FLD, and maybe why is that common phrase, contracted tendons, not quite the full picture?
Right. So at its heart, FLD is what we call a developmental orthopedic condition. Basically, the foal can't straighten out or extend one or more of its limb joints to a normal angle. It's really about a difference in length, a disproportion between the long bones and the soft tissues around them. That means the muscles, the tendons, the joint capsule itself. So yes, tendons are definitely involved, absolutely, but it's broader than just that one thing being contracted.
Okay, so it's about that inability to straighten the limb. We're talking about movement in a specific direction then.
Exactly. It's movement in what vets call the sagittal plane. Just think forward and backward motion, like bending and straightening your own elbow.
Gotcha.
And that's what sets it apart from angular limb deformities.
Yeah.
Those are the side-to-side things, like being knock-kneed or bow-legged. FLD is about flexion, not deviation.
Okay, that distinction is helpful.
And actually, while we're defining things, it's probably worth mentioning the flip side, because foals can have that too.
Oh, what's the opposite?
It's called flexor tendon laxity, or sometimes hyperextension. Here, the tendons are actually too loose, too slack. So you see joints, often the fetlock that's like the ankle or the carpus, the knee, sort of hyperextending, maybe even dropping right down towards the ground.
Wow.
Yeah, you see this quite a bit in premature foals, or ones that are dismature, not fully developed at term. But the good news there, the prognosis is usually excellent. It often just sorts itself out with a bit of time and maybe some support.
Okay, good to know there's an opposite end of the spectrum too. So we know what FLD is now. The big question then is why? Why do foals get this? Our sources seem to group the causes into two main buckets. Congenital, meaning they're born with it, and acquired, developing after birth. Let's tackle congenital first. What's happening before the foal is even born?
Yeah, this is where it gets really interesting and sometimes a bit complex. Congenital FLD often has multiple factors playing a role. A really significant one is something called uterine malposition. Basically, the fetus just didn't have enough room inside the mare's uterus to fully stretch out its legs.
So literally cramped quarters.
Exactly. Think oversized foals, maybe twins competing for space, or even just a mare with a naturally smaller uterus. That physical restriction can prevent the limbs from developing normally extended.
And that makes intuitive sense. Are there other, maybe less obvious causes related to the mare herself?
There are, although they tend to be less common. We look at things called teratogenic insults. These are external factors that can interfere with development.
Right.
So maybe the mare ate something toxic like locoweed or certain types of Sudan grass. Or perhaps she had an illness like influenza during a critical period of gestation.
Wow.
Even some nutritional imbalances in the mare, like iodine deficiency, have been implicated, though that usually shows up with other issues too. And then there's the possibility of a genetic predisposition.
So it might run in certain families or breeds.
There's suspicion, yeah, particularly mentioned in breeds like quarter horses. But pinning down specific genes has been tricky, largely unconfirmed for now.
Okay, so that covers a lot for the congenital side. Now, what about the foals born okay but then develop FLD later? The acquired cases, what's usually driving those?
The biggest culprits for acquired FLD, often popping up in those really rapidly growing foals, are usually a combination of that fast growth itself and some kind of nutritional imbalance.
So growing too fast, for their own good, basically.
Kind of, yeah. Especially diets that are really high in energy and protein.
Yeah.
The bones just like outpace the soft tissues. The tendons and ligaments can't stretch quickly enough to keep up.
Like a growth spurt gone wrong.
Okay.
But our sources pointed to another major factor, one that might surprise people: pain.
Oh, this is absolutely crucial, and it's a really key insight from the materials you provided. Pain from other conditions is a huge trigger. Think about things like fasciitis, that's inflammation at the growth plates, very common in growing horses, or OCD, osteochondrosis, affecting joint cartilage. Even laminitis, which is incredibly painful, or just a simple hoof abscess.
Right.
If a foal has pain in a limb, its natural reflex is to pull it up, to flex it, to protect it.
Makes sense.
But here's the kicker. If that pain hangs around, if it's chronic, that protective flexion reflex can actually become a fixed contracture. The tendons and ligaments effectively shorten over time.
Wow, so the body's attempt to avoid pain can end up causing this whole other problem. That's kind of ironic.
It really is. It highlights how important pain management is in these young animals for preventing secondary issues.
And what about exercise? Or maybe lack of exercise? Does that play in?
It can, yeah.
Ugh.
And interestingly, both ends of the spectrum can be problematic.
How so?
Well, too much strenuous exercise, especially on hard ground or before the limbs are mature enough, can cause micro-injuries or pain, leading back to that pain flexion cycle we just talked about.
Okay.
But on the other hand, not enough exercise, like being confined to a stall too much, means those tendons and ligaments don't get the normal gentle stretching that comes with movement. So that can also contribute.
Finding the right balance then.
Exactly. And one last piece often related to exercise and conformation is hoof imbalance. Things like the toe getting too long or the heels becoming underrun. That changes the forces on the tendons, increasing tension, and can predispose a foal to contracture.
Right, the hoof angle is so important. Okay, so we know the why. Now, the where. Where on the leg does FLD typically show up? Let's maybe walk down the leg joint by joint. What about up top, at the knee, a curvus?
Sure, so carpal flexural deformity or knee contracture. What you'll see there is the knee stays bent, persistently flexed. The foal can't fully straighten it. In severe cases, they might even buckle forward onto the front of that knee joint, which is called knuckling over. It looks quite dramatic.
Yeah, I can imagine. Okay, moving down the leg, then we hit the fetlock joint. What does fetlock contracture look like?
This one can present in a couple of ways. Sometimes it's more like hyperextension, where the fetlock looks abnormally straight, almost vertical, or even sinking down if it's laxity. But with contracture, you often see the foal knuckling over onto the front of the fetlock joint. It's more common in the front limbs than the hind. And acquired cases here often tend to show up a bit later, maybe around 12 to 14 months of age.
Interesting timing. Okay, and then further down, we get to the hoof itself. The distal interphalangeal joint, or coffin joint contracture. This is the one people often call a clubfoot, right?
That's the one, yeah. And it's very distinctive looking.
What are the telltale signs?
You'll see a hoof that looks very upright, steep. The front wall, the dorsal hoof wall, might even look sort of dished or concave. The heel is typically high, elevated off the ground. And because of that angle, the coronary band where the hoof grows from often looks prominent or pushed forward. In more severe cases, the heel doesn't touch the ground at all, and the foal is literally walking on its toe.
Wow.
This type primarily involves the deep digital flexor tendon, the DDFT, and its check ligament, which are responsible for flexing that coffin joint.
And the sources mention different types of clubfoot based on how bad it is.
Yes, they classify it by the angle. Type I is considered milder, where the angle of that front hoof wall is maybe 60, 70 degrees, and the heel usually still makes some contact with the ground. Type 2 is more severe. The angle is steeper, maybe over 80 or even 90 degrees, and the heel is clearly lifted right off the ground. In really extreme cases, the actual coffin bone inside the hoof can start to rotate due to the pull.
Okay.
And acquired club feet. They tend to show up earlier than the fetlock issues, often around 1 to 4 months of age during that rapid growth phase.
Good to know the timing differences. And just quickly, the sources also mentioned the pastern joint.
Right, the proximal interphalangeal joint. Deformity there is less common, but it can happen, often characterized by the joint sort of popping up dorsally, maybe even with an audible click sometimes.
Okay, so we've got a picture of what it looks like in different places. How does a vet actually diagnose this? What's the process?
Well, it always starts with a really good look. Careful observation, watching the foal stand, watching it walk, watching it trot if possible. You're looking for all those things we mentioned. Inability to stand normally, that knuckling over at the knee or fetlock, walking on the toes. Is the gait stilted? Or maybe stumbling? Does the foal struggle to get up?
So visual assessment first, but then there's a key hands-on check, isn't there?
Absolutely. This is critical for diagnosis and planning. The manual assessment of reducibility,
Meaning?
meaning the vet will gently try to manually extend the affected joint, try to push it back into a normal position. Can they fully straighten it out with gentle pressure? Or only partially? Or is it completely rigid, non-reducible?
Ah, I see.
That tells you a huge amount about how severe the contracture is, what tissues are involved, and importantly, it helps predict whether conservative non-surgical treatments are likely to work.
Makes sense. So after looking and feeling, do they use imaging?
Oh, definitely.
Yeah.
Radiography, taking x-rays is essential.
What are they looking for in the x-rays?
They want to see if there are any underlying bone problems. Check the alignment of the joints. Make sure there isn't something else going on like fasciitis or OCD, which could be the cause of the contracture. Remember?
Right, the pain connection.
Exactly. And ultrasonography is really useful too. Ultrasound lets us look directly at the soft tissues, the tendons, the check ligaments, assess their size, their tension, check for any damage. It can even be used to guide certain treatments or surgical procedures.
So combining the physical exam with the imaging gives the full picture.
Precisely. It's about understanding the full extent of the problem and ruling out other possibilities, like maybe a ruptured tendon, which would look very different.
Okay, let's shift to the really crucial part, fixing it, treatment. The sources really hammer home that acting early is key for a good outcome. What's the first approach, especially for milder cases or newborns?
For those mild to moderate cases, especially the congenital ones you spot right away, conservative management is where you start. And a big part of that is carefully controlled exercise. Now, this is nuanced. For contractures, you want short, controlled periods of hand walking, maybe just 10-15 minutes a few times a day on firm footing. This encourages gentle stretching.
But not too much?
Right. You combine that with some stall rests. But importantly, you want to avoid just locking them up 204/7, because that can actually make the contracture worse. They need that gentle movement.
And for laxity, the opposite problem.
For laxity, controlled exercise is more about gradually strengthening the muscles and tendons. Again, short periods, building up slowly.
Okay. And the farrier must be a huge part of this conservative approach.
Oh, absolutely critical.
Right.
Corrective hoof trimming and shoeing are cornerstones of managing FLD. It's really an art.
What kind of things can they do?
Well, for a clubfoot, for instance, they might do very careful, frequent, light rasping of the heels to try and encourage the heel to lower. Or a common technique is to glue a small toe extension onto the front of the hoof.
A toe extension? How does that help?
It acts like a lever. Every time the foal takes a step or even just bears weight, that extension encourages the hoof to break over further forward, which puts a constant, gentle stretch on that tight, deep digital flexor tendon.
Clever. And for laxity?
For laxity, they might do the opposite. Use heel extensions, or maybe a special shoe with a caudal wedge to provide support and prevent the fetlock from dropping too far down. It's all about manipulating those forces.
Very targeted adjustments. What about things like splints or casts?
Yes, bandaging, splinting, or casting are also part of the conservative toolkit, especially for more significant contractures. Splints are applied, usually on the back of the leg, to hold the limb in a more extended position.
But you have to be careful with those, right?
Extremely careful. Splints need very frequent monitoring, and changes we're talking every 12 to 48 hours. You have to check constantly for rubs or pressure sores because foal skin is so delicate.
Wow, that's intensive.
It is. Casting provides more rigid support, so it's usually reserved for more severe cases that aren't responding to splints or are non-reducible manually. But casting carries an even higher risk of complications like bad pressure sores. And because foals grow so fast, casts need changing every 3 to 7 days, typically.
That really underscores the commitment needed. Now, let's talk about that medication you mentioned earlier, oxytetracycline. It seems so odd to use an antibiotic for this.
It does seem counterintuitive, doesn't it? But this is a really fascinating piece from the sources. It turns out that oxytetracycline, when given intravenously at quite specific, high doses, much higher than you'd use for an infection, like 40 to 70 millikilograms, can actually cause relaxation of the whole musculotendinous unit.
How? Do they know why?
The exact mechanism is still debated, but the leading theory involves calcium chelation. It might interfere with calcium's role in muscle contraction, leading to this relaxation effect. And it can be remarkably effective, especially for congenital FLD if you give it really early, like within the first day or 3 of life. Sometimes you see improvement in just 24 to 48 hours.
That sounds almost like a magic bullet, but I sense a but coming.
Definitely a but, a big one. There's a Very significant risk of nephrotoxicity that means kidney damage, potentially acute renal failure,
Whoa.
especially in foals that might be even slightly dehydrated or sick. So using it requires incredibly strict monitoring. You need concurrent intravenous fluids. You need to check kidney values before and after. It's powerful, but potentially dangerous if not managed perfectly.
That highlights the stakes. So handle with extreme care. Are other drugs used, like for pain?
Yes, NSAIDs, non-steroidal anti-inflammatory drugs like phenylbutazone or flunixin, are often used. They help manage the pain associated with the condition itself or the discomfort from the stretching therapies, splints, or casts. But again, you have to be judicious, especially with foals, as they can be prone to side effects like gastric ulcers or kidney issues from NSAIDs too.
Always a balancing act. Okay, so if all this conservative management, the exercise, ferrary, splints, maybe oxytetracycline if it doesn't work, or if the case is just too severe to begin with, what's next? Surgery.
Exactly. If conservative options fail or aren't appropriate, then surgical intervention becomes the next step. The goal of surgery is basically to release the tension mechanically.
And what are the common procedures?
The most common ones involve cutting specific check ligaments. These ligaments sort of check or limit the stretch of the main tendons. So for a clubfoot, involving that deep digital flexor tendon, the surgery is usually an inferior check ligament desmotomy ICLD. Cutting this ligament allows the DDFT to stretch more, helping the heel come down.
And how successful is that?
The prognosis for an ICLD, especially if done early before there are major bony changes in the hoof, is generally quite good. Many foals can return to athletic function.
Okay. What about for the fetlock contractures?
If the fetlock issue involves the superficial digital flexor tendon, SDFT, then the surgery is a superior check ligament desmotomy, or SCLD. This one is higher up the leg. The prognosis for SCLD can be a bit more guarded sometimes, maybe less predictable than for the ICLD.
Gotcha. And the sources mentioned one other more drastic sounding surgery.
Right, that would be a deep digital flexor tenotomy. That's not cutting a check ligament, that's cutting the main DDFT itself.
Wow, cutting the whole tendon.
Yes. It's generally considered a salvage procedure. It's reserved for those really severe, long-standing, painful club feet where nothing else has worked, and the goal is primarily pain relief and making the foal comfortable, maybe for pasture soundness.
What's the downside?
The huge consequence is that cutting the DDFT leads to permanent digital hyperextension. The toe will permanently flip up because the main structure holding it down is gone. Athletic potential is significantly, usually completely, reduced. It's definitely not a choice for a performance prospect.
A tough decision then. And I assume after any of these surgeries, there's still a lot of aftercare.
Oh, absolutely. Surgery is just one piece. Post-operatively, you're looking at continued bandaging, very carefully managed progressive exercise rehabilitation programs, and absolutely critical ongoing corrective ferrary to support the changes made surgically. The follow-up is just as important as the operation itself.
It really is a long-term commitment. So putting it all together, what's the overall outlook? What's the prognosis for a foal diagnosed with FLD?
Well, as you can probably guess by now, it's highly variable. It really depends on a lot of factors.
Like which joint is affected?
Yes, that's a big one. Milder cases, obviously, tend to have a better outlook. And somewhat counterintuitively, deformities lower down the leg, like the coffin joint club foot, often actually have a better prognosis for athletic function than deformities higher up, like the fetlock or especially the carpus knee, which can be much more challenging to fully resolve.
Interesting. And I bet timing plays a huge role.
Timing is probably the single most critical factor. Early intervention is absolutely key. We're talking within days or the first few weeks for congenital cases.
Why so critical?
Because those tendons and ligaments become much less elastic, much more fibrous, and resistant to stretching as the foal gets older. The window for effective conservative management, or even for surgery to have the best outcome, is relatively narrow. Also, how the foal responds to those initial conservative attempts is often a pretty good indicator of the long-term prognosis.
It really sounds like success depends on a whole team working together consistently.
It 100% is. The dedication and commitment of the owner, working closely with the veterinarian and a skilled farrier, that partnership is absolutely crucial. Everyone needs to be on the same page and diligent with the management plan, whether it's bandage changes, controlled exercise, or hoof care.
But the hopeful part is, with that team effort and prompt action, many foals can recover well.
Yes, absolutely. Many foals, even some that require surgery like an ICLD, can go on to have normal, successful athletic careers if the condition is identified early and managed appropriately. That's a really positive message for anyone facing this.
That is good to hear. Now, we've talked a lot about treatment, but what about trying to prevent FLD from happening in the first place? Are there proactive steps people can take?
Prevention is definitely better than cure, although not always possible, especially with some congenital factors. But yes, good management helps. It involves focusing on both the mare during pregnancy and the foal right after birth.
What about the mare?
For the mare, it's really about providing optimal, balanced nutrition throughout her gestation. Avoiding getting her too fat, but also making sure she's not deficient in anything. Steady, moderate exercise during pregnancy is generally good too. And of course, monitoring her health, managing stress, and avoiding known risks like fescutoxicosis in certain areas, which can lead to dismature foals who are prone to FLD, particularly laxity.
Makes sense. And then once the foal arrives?
As soon as the foal is born, close observation is key. Watch how it stands, how it nurses, how it moves in those first few hours and days. Early identification of even subtle signs of tightness or laxity is paramount.
Catching it super early.
Exactly. And then for those rapidly growing foals, especially in breeds known for fast growth, it's about appropriate nutrition. Monitoring their growth rate, working with a vet or nutritionist to ensure they're not getting excessive calories, particularly from high carbohydrate or high protein feeds that can fuel that bone growth outpacing soft tissue issue.
So managing the growth spurt.
Pretty much. And starting regular corrective farrier care early, maybe as young as 4 to 6 weeks of age, just to keep the hooves balanced and address any minor deviations before they become big problems. Plus, and this goes back to the acquired causes, promptly diagnosing and treating any source of pain in a young foal, whether it's an infection, an injury, or something like cystitis, to prevent that pain-induced contracture cycle from starting.
Right. Addressing pain quickly seems vital for so many reasons. Okay, so wrapping this all up then, what's the big takeaway for our listener from this deep dive?
We've gone from just hearing contracted tendons to really understanding flexural limb deformity as a complex issue, right? We've looked at the different causes, congenital, acquired, the role of pain, how it looks in different joints like the knee fetlock or the classic clubfoot. We've covered how vets diagnose it using manual checks and imaging, and we've explored that whole range of treatments, the exercise, the amazing work farriers do, those specialized medications like oxytetracycline, and the different surgical options. Yeah, and I think if you zoom out, this condition really highlights just how incredibly delicate that process of development is, how all these different tissues need to grow in sync. And it powerfully underscores the impact of early intervention. What might seem like a small issue early on can really snowball if it's not recognized and managed holistically, considering everything from nutrition to pain.
It really forces you to think beyond just the obvious symptom, doesn't it? To consider all those interconnected factors, the mare's health, the foal's diet, its environment, hoof balance, pain. Everything contributes to that foal's musculoskeletal health.
So here's a final thought to leave you with, something to maybe mull over. We talked a lot about how significant pain is in causing acquired FLD. So the provocative thought is this: how might improving our ability to recognize and manage pain really early, maybe even subtly, in all young animals, not just foals, potentially prevent a whole cascade of secondary problems that might seem completely unrelated at first glance? Something to think about until our next deep dive.